or hereditary hair loss. It's very common for patients to come and ask you that, actually my uncle's father's brother's auntie's grandfather was bald. So somebody in the family at one place will always be bald. And I don't know who gave the idea that if you have hereditary baldness, it is untreatable. If you can treat hereditary diabetes, you can treat hereditary asthma, why should you consider hereditary baldness untreatable? Hereditary baldness is 100% treatable. It only means that if you have a history in the family of losing hair, you can lose the hair more easily. It doesn't mean you have to lose it. If you know your father is diabetic, you can always eat less sugar, manage your weight, exercise, control your diet and never get the diabetes. So definitely hereditary hair loss is treatable. Now the gene concerned with hereditary hair loss has been identified. It is not a gene, it is a genome or a set of genes, and hereditary hair loss comes at the age of 40, never lower than 40. So at 40, 45 if you start losing hair, it's because of hereditary or senescence. You don't start losing hair in your 20s and 30s and say this has come to me from my mother or father. It can come to you from either side, from mother's side or father's side. It can skip your brothers, sisters, it can even skip generations. And 40% of the outcome of this hair loss is influenced by the genes, 60% is controlled by lifestyle, nutrition, care and weakness of the roots. So it is just like we know that heart disease, diabetes or any other diseases are multifactorial and are influenced by many causes to result into even your sedentary lifestyle, lack of exercise is going to cause you or diabetes or heart disease. Similarly, hair loss is a multifactorial disease. One of the factors is hereditary. So these are patients whom we have treated for hereditary hair loss. This is without using finasteride, only minoxidil and the vitamin program. And within 4 to 6 months, you start getting the hair back. So these are results of 4 months each, because we consider 4 months to be one cycle. As you further continue, the results will improve, they don't stop at this level. So this is a ethnic variation, a Chinese Korean person who was working at a multinational and had hair loss. So we also have proved that it works against all ethnic variations. You can have hereditary hair loss in girls as well. This is post pregnancy hair loss. We know you support the nutrition any which way it comes back. Then this is diffuse thinning, which is improved with a treatment in 4 months. This is thyroid imbalance, typically starts as thinning in the frontal area. This is again PCOD hair loss. These people have been treated just with minoxidil and the vitamin program without using any other anti-androgens.